Bismillahirrahmanirrahim. This presentation is regarding osteoarthritis changes, particularly uh, the radiological changes which happens in the bone. Now, osteoarthritis is one of the commonest knee joint and other joints pathology. It affects millions of people, and to appreciate osteoarthritis, one must know what are the normal X-ray findings and what changes takes place after osteoarthritis. Now let me start with the normal X-rays first. This is an X-ray of a knee joint of a young 30-year male. The knee joint is formed by the lower end of the femoral condyle and upper end of the tibial plateau. Look at this X-ray. The margins of the lower end of the femoral condyle is very smooth, very regular, and so are the margins of the tibial plateau. Very smooth, very regular. Now the lower end of the femur and upper end of the tibia has got cartilage over here, and this cartilage is articular cartilage over here and over here. This is articular cartilage. This articular cartilage is hyaline cartilage. It's very firm, it's very slippery, and the movement which happens here is almost frictionless. And the knee joint is a synovial joint. It has got an inner lining of the synovial membrane. The synovial membrane will be lining the inner side of the capsule, and this is the synovial membrane. And in between is the joint space between the lower end of the femur and upper of the tibia. There is a small joint space, and this contains the synovial fluid. The synovial fluid acts as a lubrication for the movement, and there are several recesses in the synovial membrane which helps to extend the knee joint. So this is a brief histological picture of knee joint having cartilages at the hyaline cartilages at the two ends of the bones, and a synovial membrane containing synovial fluid. Over here, X-ray, what you can see is, let me get rid of this. This is the lateral view of the knee joint, and here you see the patella. Patella is the sesamoid bone in the quadriceps tendon, and the articular cartilages also lines the inner surface of the patella. So all the surfaces over here, this is a 30-year male, are very smooth, very rounded, and there are no rough spaces in between. Now what happens in early osteoarthritis? Now this is a knee joint of a 68-year male, and if you look at it, Here, the joint spaces is almost preserved. They are normal. But there are certain bony changes over here. If you look at this, this is osteophyte, body spur. The cartilage has started degenerating. Similarly, over here, some of the cartilages is abnormal. For the rest of the cartilages, here also there is some slight changes, very minor changes in the cartilages. So these are early changes of the osteoarthritis. 68 year male, but normally a 68 years male would have some changes, but it's not necessary. Osteoarthritis is a disease of the elderly patient, but all elderly patients do not suffer from osteoarthritis. Now we come to this picture. This is a 42-year female patient. That's the right knee and that's the left knee. And look at the significant changes of the osteoarthritis. The joint space has become narrow, the cartilage is eroded, and the bone surfaces are almost touching each other. Over here, the joint space on the medial aspect, medial joint space is much narrower, almost as narrowed as the lateral space. So throughout, joint space is narrower. There is also a loose fragment of the bones over here, and articular surfaces, articular cartilages has become very irregular. Similarly, over here on the left side, again, almost the two bones are almost in touch with each other. There is loss of joint space. The medial compartment over here is much reduced as compared to the lateral compartment. And there are also osteophytes formation. So here there are significant cases of osteoarthritis. Osteoarthritis may also involve the whole of the knee joint. The tendons which are, the ligaments which are binding the two joints together, lateral and medial collateral ligaments, muscles which are surrounding the joint, they may become weaker and they may become involved in inflammation and the joint may become swollen. So in severe cases, there may be pain, stiffness and loss of movements of the joint. So these are the changes which takes place in osteoarthritis. Now osteoarthritis is in pathology, you got cartilage erosion, articular cartilage, hyaline cartilage become eroded, and so much so that the bone may start rubbing together, bone rub against bone, and it may form spurs and osteophytes, bony changes. And the whole joint may be involved with ligaments and muscles becoming weaker and tendons becoming weaker. So the joints involved are commonly knee joints. In hand, usually it's multiple joints which are involved in different fingers. Hip joints, osteoarthritis of the hip joint, and spine, leading to narrower of the disc spaces between the vertebrae and causing nerve pressure on the nerve and like sciatica and so on. The symptoms which are usually are there is pain, particularly on movements of the joint. There is joint stiffness and restriction of the movements, limitation of extension, flexion, and so on. And there may be grating sensation on moving the joints. The factors which are related are usually age-related factors, as usually occurs after the age of 50 years. Somehow females are more affected than the male. Obesity is one factor where the joint has to bear a large amount of weight. Then there may be joint injuries, particularly sports injuries, maybe a history of avascular necrosis, like fracture neck femur, where the head of the femur becomes uh, destroyed of his blood supply and goes and undergoes avascular necrosis. And hemorrhages, repeated hemorrhages in the joints like in hemophilia. Now, what is the treatment? There is no cure for and no definite treatment for uh, osteoarthritis. Usually, physical therapy, exercises, keeping oneself active, avoiding falls, maybe some medication to relieve pain, changing the lifestyle will help to slow down the progress and maintain useful function of the joints. If the joint has nowadays there is replacement therapy, but in the knee joints when everything is destroyed, you can have a new joint with the new replacement. So thank you very much. I stop over here and see you later. Thank you.